It's about 20 after 4 right now, and the sun is already starting to set.
Yeah, we showed you that live picture just a little while ago. That makes some people sad and depressed, but there is something you can do about seasonal affective disorder, also known as SAD.
UW distinguished psychologist Shilagh Mirgain is with us once again today. Welcome to you.
Hi, Shilagh.
Hi, great to be here.
In case people don't know, what is SAD?
SAD, or seasonal affective disorder, is a form of clinical depression that occurs seasonally, typically during the winter months. If people are wondering about, do I have SAD? Am I sad? They can look for two criteria. One, are you feeling down or depressed most of the day, nearly every day for at least 2 weeks? Or have you lost interest or pleasure in things that you typically enjoy? And again, that's persisting for 2 weeks. There can be some secondary symptoms like weight or sleep disturbance, fatigue, cognitive impairment like difficulty concentrating or focusing, or just feeling helpless or hopeless or sluggish. And again, we're looking at that occurring seasonally during the winter months primarily.
And if you have any of the symptoms that you just listed, what can people do? There's a lot of different things to fight this, right?
Absolutely. We want to be proactive of really safeguarding our mental health and preventing the winter blues and preventing SAD. Number one, stay connected. Social isolation is a risk factor for contributes to depression. Number two, light therapy. As you mentioned, it's getting dark already here in Wisconsin, and the sun's rays aren't strong enough, and so that can disrupt our circadian rhythm. So get outside on the sunny days. Open up those curtains early morning. Sit and read in front of a window, or even consider light therapy, which I personally use, which is using a box that has a full spectrum light that has 10,000 lux of light that you sit in front of for 10 to more like 20 to 30 minutes in the morning, and that mimics that sunlight, and that can be very helpful in regulating those circadian rhythms that can boost our mood.
Exercise can help, self-care, and there's nothing wrong with getting professional help as well.
Absolutely. Exercise is a great antidepressant. The recommendation is at least 3 times a week of aerobic or resistance training for 30 minutes. Consider vitamin D supplementation. Again, the sun's rays aren't strong enough for us to produce that in enough dosage regularly, so talk to your physician if a prescription would be useful. And if you are struggling with depression, if you're having trouble functioning or considerable distress, reach out to a behavioral health specialist or your physician, because medication and talk therapy are really effective treatments of depression.
And it's a time of year when a lot of things collide. It gets darker earlier, it's getting colder, the holidays are coming, and they can be very stressful, so it's a bad combination of things. This is a live picture. The day is coming to an end.
Yeah, very much so. There's really a cluster of stress, so really prioritize your well-being, get sleep, eat nutritious food, minimize alcohol, and make sure you're doing simple things for your joy that can really boost your mood in these darker, colder days ahead.
Yeah, and it's going to get worse for the next couple of months as the days get shorter and shorter, but then
it gets better.
And it gets better.
Yeah, that's great advice.
Thanks for being with us today.
Thank you, Shilagh. Good to see you.
Thanks for having me.